Hi, everyone, and welcome to another episode of Let's Get Vaccinated, where each week we deliver a healthy shot of science and facts. So, how is everyone doing today? I hope you're all having a nice summer so far. We've had some really brilliant weather in New York, so I hope it's been lovely wherever you are watching from. And do say hi to us in the chat and let us know where you're watching from today. We'd love to hear from you. So we do two things on this show. We answer your questions about vaccines and the pandemic, and we all learn how to effectively communicate science because sharing science is how we keep our communities safe. In case you don't know me, my name is Lucky Tran. I'm a biologist and science communicator based at Columbia University in New York, and I'm the managing director for March for Science. So today we are speaking about a really important subject, long COVID. So many people are dealing with long-term health effects from long COVID, yet I don't think we're hearing enough about it in the media, and policymakers aren't factoring it enough into their public health decisions. So thank you for all joining us as we navigate this really critical topic. And as always, this is an interactive show, so please do leave your questions in the chat and we'll try to address them as we go along today. And so to help us today, we have a very special guest. Please welcome to the show Dr. Nisreen Alawan. Dr. Alawan, MBE, is an associate professor of public health at the University of Southampton. During the COVID pandemic, she used social media to communicate public health messages and to call for long COVID to be counted and measured in by the federal government. So, Dr. Alawan, how are you doing today?
Hello, thank you very much, Lucky, for having me. I'm fine, thank you.
That's great. And we are really so honored to have you here. And we really appreciate all the amazing work you've been doing as a scientist and advocate and someone speaking about long COVID, in the UK and around the world.
Thank you so much. Really appreciate that. That's very kind.
And so I'd really like to start because, as I've been saying, I think whilst most people probably have heard about long COVID, I don't think it's been at the center of, media coverage or policy making enough. So a lot of people might not know all the details. So I'd like to start with the most basic question. What is long COVID?
Yeah. Long COVID is basically and simply not going back to your normal state of health before getting the infection, the SARS-CoV-2 infection. So not going back to your normal level of health and activities that you used to have. And basically that means either continuing with the acute symptoms that you had during the acute infection, or continuing with some of them, developing new symptoms after weeks or even months, and also in many cases these symptoms affecting your day-to-day life and activities and your ability to do work and care for others and all sorts of and exercise. Um, so that's what we mean by long COVID. In terms of the symptoms of long COVID, they are very wide ranging. And as I said, many of them are the symptoms that you have when you have acute COVID. So, some of them are cough and breathlessness and chest pain or chest heaviness and the muscle aches and joint aches. And mainly, and that's very common in people with long COVID is what we call the fatigue, which is really way beyond just feeling a bit, tired. It's that feeling of utter exhaustion that people feel and unable to do things, and some of it comes after doing some physical activity or mental activity, and also some people have what is called a post-exertional malaise, where again that's something that happens after a degree of physical activity that people experience. So yeah, we can talk about more about the symptoms, but they're really wide ranging in terms of what the symptoms are, in terms of their severity and how much they affect people's lives.
Thank you so much for that summary. And you yourself have been personally affected by long COVID, right? So in the early days of the pandemic, you got COVID and you've been dealing with long COVID. So I would love if you could share with us your personal experience with long COVID.
Yeah, so I got the COVID-19 symptoms in March 2020, and that was the first wave of the pandemic in the UK. And I didn't, it wasn't really severe. The infection, it felt like a flu-like illness. I had the fever, the cough, that feeling of the chest tightness and heaviness and muscle aches and joint pains and leg pain. And then, so really, it was distressing, but it wasn't something that I thought I need to go to the emergency department or go to the hospital for. And then what happened, and we were told at the time, it's only in somebody who's got my characteristics, with no background risk factors in my age group, shouldn't be worried. It should be completely clear in 2 weeks. The 2 weeks passed, and my symptoms were still there. They were actually, one day I feel, oh yeah, that's it, I'm getting better, and then the other day it's coming back. And then week 3 and week 4 came, and it was the same kind of fluctuating nature, but it wasn't completely going away. And what really kept me sane was other people on social media posting that they were experiencing similar pattern. So that really happened, and then I had a period after for a few weeks where I thought, yeah, that's it, I'm almost there, it's recovered, and then the symptoms came back, and I've developed some new symptoms like palpitations, um, and that was the pattern really in terms of long COVID that I've experienced over the following months. That relapsing nature was a big feature in my long COVID, but it's also a big feature in many other people with long COVID as well. So that's the story, and I think when this a few months in, by summer 2020, I really was astonished that nobody was talking about it. Nobody was, well, people were talking about it, as in on social media. People who were experiencing were talking about it. The name long COVID emerged, and the support groups were forming on social media. But actually, in science and medicine and policy and public health, there was nothing there about this morbidity that's emerging with all the huge numbers of people infected. And remember, most of these people couldn't even get access to testing because testing was restricted in particularly in the first wave of the pandemic in the UK. But I think in the US as well, it was hard to get the test. So then I started talking about and putting articles in scientific journals, doing scientific webinars, and saying we need to really define what this illness is. We need to understand what we can do about it, but also we need to count it, because all these policy decisions that were happening about lockdowns and the non-pharmacological interventions and what we do here or there were completely based on acute measures, which are the number of cases, number of deaths, and number of hospital admissions. And there's no quantification of that illness burden that was developing.
Yeah, thank you so much for sharing that with us. And as you said, your experience with long COVID really inspired you to become a more public-facing health campaigner, right? And you've led calls for long COVID to be counted in national data and to improve research on it. We really appreciate and thank you so much for all of your advocacy. I was wondering if you could share with us why it is important for all of us to speak up about long COVID and maybe share some tips that you've found going through the process on how to do effective advocacy.
Yeah, I mean, I think I got into it because I just saw this gap, as I mentioned, that I saw a gap that this is something important, people need to talk about it. And actually, when I started talking about it, I was astonished because I thought surely everybody else is thinking, we've got a problem in the chronic illness that could develop out of this. Um, but everybody was so busy within the acute response and the kind of looking at the acute effects. I think understandably, but maybe at the time, but even now, when things are communicated now, they're still communicated in terms of just the acute effects of the virus. Number of hospital admissions and deaths, and that's kind of all the policy measures are based on that. So I really started saying, well, in order to change that, we need to quantify long COVID in a similar way that we're quantifying these acute outcomes. And that's when the count long COVID started. So in terms of tips, I think the tip I have is I was really passionate about something. I felt something needs to be said, and somebody needs to say it. So I think it was mainly the motives of it. But I think it's really important to in communication on social media and other outlets to be really clear about the message, to be really clear about what is it that you want to say about something. And I think the message around counting long COVID was clear. We don't necessarily have to understand what it is, and there's so many other questions around it, but you're not even quantifying it. Let's just quantify it, count it, see how much it is, and that was a clear message.
Yeah, thank you so much. That's really invaluable advice. And I think, yeah, two things really sort of struck me about your advocacy. One is that obviously you've been personally affected. And I think the people who have been personally affected are often the best advocates for any cause. So that's important, is highlighting the people who are impacted, because they can speak, very raw, truthfully about an advocacy issue. I think that's really important. And as you say, you got to have message discipline. I teach science communication, at my university, and something, as you say, you've got to know what's the goal you're trying to achieve. How do you put out a message that's consistent and over so that you can achieve that goal? And it's really, paying off, right? I saw a report today, was it in the UK, that 2 million people have long COVID. Actually, tell us about that. Is there anything, I haven't read the report yet. Is there anything interesting about that new study?
I think it just so we had some previous figures from the Office of National Statistics that was based on a random population-based survey, infection survey, where they're continually kind of testing people, and that's a good source because it's a random sample rather than a selected,
Mm-hmm.
more biased samples. And this other study today was again from another infection survey it's called the REACT study, and they do regular testing as well. And actually, but their figures were even more than the um, ONS figures, So the prevalence seems to be even higher in terms of long COVID for at least more than 12 weeks. So, and the range. I think there are another study, published recently today as well. Other studies. I think the range is concerning, whether it's where you say it's 1 in 10 or 1 in 3, along these lines. So these are mainly non-hospitalized people, so people who have not had it severely at the start. That's a very concerning prevalence rate for an ongoing
Yeah.
illness for months. Even even if you assume most people will recover, which we don't know, uh,
Yeah.
because that means that sort of disability happening, for a long period of time. But actually, the ONS figures show that um, there's a lot of increase in the number of people who've had it for over a year now. So over 300,000 in the UK. So that's quite concerning in terms of the duration of it as well.
Yeah, and I
Yeah.
think, so I love the tweet that you put up. I'm just going to show it to everyone yesterday, that those saying rising COVID case numbers don't matter because deaths are low. No, they do matter because of long COVID, right? It's as simple as that. They do matter. And I do think there's such a hyper focus on hospitalizations and deaths, which do matter. They're very important, but it's not the whole story. And this is really why it's important to talk about long COVID. And it's a point that you've been making over and over, right? Because I don't think policymakers or people in the media or people in positions of power are doing that enough. And it really does matter.
Yeah, it does matter, and there's no excuse. We have so much more information now. We're in the second year of the pandemic, and still you don't see that connection. Even if policymakers talk about long COVID, they talk about it separately as if it's something that happened in the past, and we have to deal with patients who have it. But they don't make the connection that's actually something that's continually happening, as long as we're not controlling the infection as much as we can, or as much as possible. And there are things that can be done. So I think that connection is still, sadly not happening. I want to say something about what you said about me being experiencing the condition and communicating about it. And I think that's really an important point that I've learned along the way. This gives you a lot of understanding in terms of what you're talking about because you've lived the experience. But I think which I was something I wasn't aware of, and I think that applies to science in general, is that when you as a scientist or a doctor or public health, communicator, you've experienced it, there is some other people who are perceive you then as biased because they say, well, you've got that view, but that's not really an objective view. And I think it's really important to challenge that because because we've got this thing about science needing to be objective, and actually there is no such thing. Everybody's subjective in a certain way,
Yeah.
and your life experiences will affect you. And it's about us. If you're being transparent, saying, "Well, actually, I'm talking about this. I've experienced it," so people know where you're coming from. But I've also got this scientific knowledge that I'm applying to it as well. I think that becomes very powerful, but there is a bit of almost like a stigma, I think, even within the science community.
Right.
And that's not just for long COVID, I think for mental health conditions and all sorts of other conditions as well. So it's an important point to point out, to bring.
Yeah, I can't upvote that comment enough. I think that's really central to what we do as March for Science's advocacy community. You know, our thing is that science is political. That is just how it is. And lived experience matters when it comes to applying science to, you know, human endeavors, societal endeavors. We have to take that into account and make it a central point. If we care about social justice and using science for the common good, that's how we have to approach these things. We can't dismiss them. And you're right, our field is not great at doing that. And so that really is the internal work that we are doing. So as we're dealing with these big problems, we're also having these conversations within our field saying, how can we do this better? How can we take into account people's lived experience and different experiences? I think that's really important. So yeah, appreciate all your amazing advocacy tips. They're really important. So please, everyone out there, please, you know, take Nisreen's lead and apply them to your work. I think it's really important. So how about we get onto we have amazing audience questions, speaking about having this conversation about long COVID, which is really important. We really appreciate all of our community submitting questions. Keep submitting them in the comments if you think more things come up. But it's really important to talk about these things so that we can do things about them and ask our policymakers to do things about them. So maybe coming back, our first question here is from Maddie Long. So you already talked about signs and symptoms. Maybe you could sort of reiterate them and say, like, when does long COVID start? Because I know a lot of people, you know, they might have an asymptomatic case, then they'll notice things weeks later. So, you know, how do we answer that question? That's sort of a blurry question, right? How does long COVID start? When does long COVID start? Yeah.
I think I mean they're different cutoffs. So you know some would use 4 weeks. So if your symptoms you've not recovered after 4 weeks, then you've got it. Some use something like 12 weeks. But I would usually say if you've not recovered from your acute infection symptoms after 4 weeks, then that looks like long COVID, unfortunately. So how it develops, some of it's just a continuation, or maybe your acute symptoms, but a bit less severe, or even more severe. Um, People, concerning that people are developing new symptoms after weeks as well. So one of the main things that people maybe notice more or develop more is the cognitive dysfunctions. People start noticing the poor memory, poor concentration, what people describe as brain fog, dizziness, confusion. So these kind of symptoms, the cognitive symptoms, the studies have shown that they probably become a bit more common a bit later on, after weeks of the infection, and I don't really know still whether they are genuinely developing then, or whether because you're having an acute infection, you're not trying to use your you say your concentration, you're not doing a job, you're ill, within an infection, and then you start going back and trying to do your daily tasks, and then you notice all of these cognitive functions. So that's still out, but it's definitely there, and it's one of the most common symptoms of long COVID. And then you've got, it's a multi-system disease. It's rarely just one system. So you could have the chest, you can have the systematic system of symptoms of fatigue and aches and pains, and you can have the neurological symptoms, and you can have skin rashes. And the gastrointestinal symptoms, so diarrhea, abdominal pain, vomiting. So it's, for most people, there's more than one system involved in it. For some people, there might be just one symptoms, such as the loss of smell and taste, and that persists for a long time in some people. So it's variable in that sense.
Yeah, absolutely. And just building on this point, I thought this comment was good too. I know that all we hear in the media is fatigue and brain fog, but there are tons of other serious health issues that long haulers face, right? I think to re-emphasize that, because we do see a lot of op-eds and a lot of coverage in the media about it's fatigue. It is fatigue, but it's so much more, right? There's cardiac issues, GI issues, other things, right?
That is a great point, because actually the more and more I read about it, particularly in mainstream media, it is really conveyed as fatigue, just fatigue, for a lot of it, but it's not. And I think people with the fatigue have other symptoms as well, even though they have the fatigue. And I think fatigue itself, I think long COVID maybe made others look at what exactly do we mean by fatigue, and it's just, I think what people mean by it is something much more than just feeling tired. It's that kind of sense of maybe general malaise in the body. It might come with some sort of pains and aches and things like that. So I think it's about really again what we mean by fatigue, and I think there is something about describing the symptoms as well. And I then relate to, say, children who have long COVID. That must be very difficult for them, because even for the adults, there are symptoms that are hard to describe. Not only the fatigue, the type of pain or the type of, so for me, for example, personally, I had this pain. It's not really pain, but it's like something sitting on my chest. It's like a heavy, something heavy sitting on the chest. So it's not a typical sort of chest pain. So I think we need to pay a bit more attention about how we ask the questions about the symptoms and how people describe them. As I mentioned, that's sometimes it's difficult for adults. So you can imagine that's even more difficult for children. And then what happens is it gets all lumped up saying, well, this is just fatigue. So yeah, I think
Yeah.
it's a great point to make.
Absolutely. And I'm really worried, like from an advocacy perspective, I'm worried that, when we cover things like that, we're really minimizing, again, lived experiences. And there's like a goal, right, between people who want to minimize that because it's inconvenient for like a lot of
Yeah.
people who are making policy decisions to say that it's more than fatigue. So I think that's
Mm.
really a great point, how we talk about these issues and really to listen to the people who are experiencing, these symptoms is really important because it's something that is going to take a while to study for us to know from a data point of view. We really need to listen to the patients who are
Mm.
suffering at the moment. We can't close our ears, so that's really important. Speaking about, I think you mentioned children. I know we have a lot of questions about this. So this one's from YouTube. Are there any studies showing correlation between long COVID and age? And more particularly, do children have more or less propension to get long COVID? Can children get long COVID?
Yeah, the children can get long COVID, and we've got studies around this, but much less. We don't have as many as for adults. In terms of correlation with age, it seems to be mainly predominantly in working age adults. Between 20s and 60s, shall we say? That's probably the kind of the highest prevalence, and then for children, it is less. There's less prevalence. So, for example, the Office of National Statistics figures, generally they state it's about 14% prevalence. So, for out of everybody who tests positive, including the asymptomatics, 14% would have at least one symptoms at 12 months. For children, their figures is 7 to 8%. So although that's lower than the average and lower than the adults, but it's quite a concerning percentage as well. Uh, if you actually put it in context of how many children are getting infected with SARS-CoV-2, and how many countries and places in the world really don't. It doesn't matter to them. It doesn't matter so much,
Yeah.
in terms of how many children are affected, because of this narrative that it doesn't affect children. So if we have 7 to 8%, you know, developing, having at least one symptoms, even if it's just the fatigue, but also other symptoms, cough and headaches and skin rashes and all of those sorts, and struggling to maintain their activities, going to school. That's a big problem. So data is emerging around children, but really it's been, I would say, neglected even more than the
Right.
adults long COVID. Yeah.
And that's a big conversation that I'm worried about here because as we know, like, in the United States and most places, we don't, children can't get under the age of 12, can't get vaccinated yet. So they are vulnerable, especially with the variants coming around. But I feel like policymakers are making decisions that don't take into account long COVID and the effects on children fully at the moment. So it's a really worrying area of policy, which is why we have to talk about it and, keep it visible in the public sphere.
Mm, absolutely. Absolutely. I think that's why, yeah, I feel like a broken record really in terms of long COVID, but
I know.
I never got to a stage where I felt, right, everybody's taking this really seriously. So, I can stop talking about it. Many more people are talking about it, but it still needs flagging all the time. And one thing that people say, particularly actually when you talk about children, is that, well, they say, well, you're just alarming people, you're scaring them by talking about these things. um, and it is a quite, um, it's distressing, I think, because again, you don't want to. Nobody wants to alarm people, and we're all affected by this
Yeah.
pandemic, and we all want to balance things. And obviously, particularly to do with children, you want to balance the risks and harms and everything, and you want to do what's best for them. But I think it's really important to talk about this because there needs to be awareness about it. There needs to be awareness that this could happen, and then when children present with that, then that's more recognized, but also from the prevention point of view. Um, and it's not black and white. So when you say, oh,
Yeah.
there's a risk of long COVID in children, it's the alternative is not straight away saying, oh no, they have to stay home forever and shut all schools and everything like. It's
Right.
not like that. There are things you can
No.
do that I mean, in public health, there are measures you can take
Yeah.
that you can try and minimize the spread of infection while trying to maintain that kind of education, going to school, etc. So it's really struck me throughout this pandemic how black and white the messages are,
Right.
in terms of that kind of there's nothing in the middle. You either looking down, everything's bad, or you don't do anything, and it's not like that. And there are stages of trying to manage this infection.
Exactly. I think that's a really good point. And I think in the political realm, that's sort of why, because a lot of these policy decisions are political. So it
Mm,
behooves people to make them black and white. But we in public health, we in science, we know solutions
mm,
are very nuanced, they're very complex. But
mm,
we're not like sort of wanting to keep people down. We feel like we need to speak about things because we want to figure out how to take care of people who are vulnerable or marginalized. And, that's really important thing with public health. So I think that's a really, really great point. All right, sort of going back to sort of some of the questions. So how long, I know this is a difficult one, how long does long COVID last? Because different people have different experiences,
mm.
right? And so this is a tough question to answer, but I understand a lot of people, some people got it at the start of the pandemic and they're still dealing with a lot of symptoms. So they're wondering, how long does it last?
Yeah, I mean, it is a difficult question. Some people, I mean, some people are getting better slowly, so that although it's not completely going away, they're noticing improvement in the symptoms. Remember, many people with long COVID have learned to live and deal with their symptoms, so they adapt their lives so that they can deal with their symptoms as much as possible, avoiding certain activities, for example. So then it's hard to assess sometimes complete recovery because you're really trying to avoid triggering those symptoms. Um, and the other difficulty about long COVID is that relapsing nature. I mean, I've had several times where I thought I've completely recovered, and then I get a relapse after
Right.
that. And I think that's a common story that people are experiencing as well. So when do you then say that's it, that's complete recovery? There needs to be an element of time in that, and to kind of establish that. But I don't hope people don't despair. I think
Hmm.
generally, there are many people recovering or improving at least, even without the science knowing exactly how to deal with this. They're
Hmm.
by, following things, pacing themselves, knowing their energy limit or trying to handle their symptoms as best as possible. And then some of them just get better spontaneously. Um, and the science is moving now. So hopefully, for those who are not recovering, we will get some answers soon in terms of what could help.
Yeah, absolutely. And speaking about this, what's the current state? And I know this is a complex question as well in terms of therapeutic approaches and maybe other treatments shown to decrease the symptoms of long haulers. What maybe you could give us a summary of where we're at with that? I know it's a vast and complex field.
Yeah, I mean, it is a vast and complex field. There's no magic, a bullet for long COVID that we know of. So, so far, it's really important for people with long COVID to get proper assessment, clinical assessment, and investigations, because there are things that may be underlying their symptoms that could be treatable. So, for example, if there are blood clots detected, or some people have inflammation of the heart, so that inflammation of the lining of the heart, and that could there are some protocols for managing that as well. So I think it's really important for people to be taken seriously, definitely by their physician, by their healthcare provider, and have the appropriate assessment and investigations. And then based on that, there could be treatment option, but I think it's a bit more personalized now in relation to how people present and what their symptoms are. Definitely, people shouldn't be dismissed straight away, saying, this is, there's nothing there, or doing very basic investigations, saying that's it, there's nothing there, and you just need to get on with it, and or it's all psychological and etc. We know that it's unlikely. There are more and more studies finding long-term, a pathological effect of COVID and in long COVID. So, but I think that they need to have the proper assessment first, rather than jumping into one sort of treatment or rehabilitation.
Absolutely. And Kayla has a comment. She's still searching for basic answer of how to get well. Symptom list is long and specialists have no answers. Thank you for letting us know, Kayla. And we're so sorry to hear that. We hope, you get the care you need. Maybe you could speak about, because I've been hearing about this from lots of long haulers, because it's, there are such diverse symptoms. It's hard. And maybe there's a difference between what's happening in the UK with the NHS and the healthcare system here. But, maybe you could give some general comments on, for something that's a new disease where not a lot of people know about it, a lot of specialists are struggling to come up with answers. Do you have any tips for finding the right doctors or getting the care that you need?
Yeah, I mean that's hard for me for in the US context, because I don't I don't know exactly
Sure.
how it works. I mean, in the UK, it's you go to your primary care doctor, so to the GP, and then the GP would do some basic tests, and examine and try and find something, rule out things that they can find. That what's happening in the UK, which I don't know if you now have in the US, is what we call long COVID clinics. So they're specialist clinics
Mm-hmm.
for long COVID patients. They're supposed to be multidisciplinary, so that if you have more than one system involved, then there's different doctors, or there's a team that would look after you. But even with the long COVID clinics in the UK, they do vary, in terms of what they can offer across the country. So there needs to be a bit more of a standardization, I suppose, in terms of what are the main investigations that people should have, in terms of their symptoms. And I think that's still developing, and that's really important. I think it's important for people to get the diagnosis. Sometimes, not even if there's no definitive treatment. I think the first step is to try and get that diagnosis of long COVID, or I suppose PASC in the States. To and then that's important for people to have that. And one big thing was, um, one source of discrimination was that people who didn't have that original PCR positive test, that they didn't even get that
Right.
diagnosis. So then you don't even know what you're investigating or treating. It becomes much more vague. I think if you know that it's something at post COVID or long COVID, then at least you've got that, and then you can start being taken seriously and start your journey in terms of what your symptoms are.
Thank you for that. I'm going to come back to that PCR test thing because I think it's important, but something I will add, and I think we'll do another follow-up show after this with some doctors in the US so that we can sort of expand upon that, how you navigate the US care system. But I don't want to do a deep dive. I've lived in the UK, I lived in the US and Australia, so I like comparing different health systems. So of course in the UK, people have a primary care doctor. It's a more centralized system. A lot of people in the US might not have primary care doctors, which makes it harder navigating the system. The thing that you said, we're starting to have long COVID care, clinics here. But from what I hear is that the UK is far ahead in organizing that over there. I know the NIH has funded COVID clinics here, but according to different areas, they're not that far ahead yet, but this is what we need more of. And so I would say, as an advocacy perspective, call your representatives and say, we need this, because so many people are dealing with these issues. It's an important health issue for many people. We need to get organized. We need to get funding on this, and that will be important. So on the PCR test, I think we had several questions about this. So some people are saying, if you happen to catch a breakthrough, well, actually, I think there's a different question. Let's come back to that question in a sec. That's a good question. Sorry about that. I was throwing the wrong one up. Well, I guess the question I wanted to ask, because I know maybe it's related, because I think testing is going down in the US at the moment. And I think what the CDC is saying is if you have asymptomatic, even if you've been exposed to someone who likely had COVID, if you don't have the symptoms, and especially if you're vaccinated, you don't need to get tested. But I think that might be a problem in terms of long COVID, right? Because to get care, a lot of places require you to have that positive test. And so I just want you to expand on that to sort of say,
Yeah.
why that's important that you get tested if you think you've been exposed, even if you're not dealing with bad symptoms right now.
Yes, it's really, really important in the context of long COVID to have that test. So if you symptoms are not even bad now, if you have doubts or you're not sure, or you don't think it's COVID, I think it's really important. People don't have then in mind that if it is COVID and if they develop then long COVID after, then actually establishing the diagnosis and obviously then the care gets affected is much more difficult if you don't have that PCR test of that positive test because there will always be doubt about whether you had COVID or not. And then because we don't know much about long COVID and these symptoms are variable and there are a lot of symptoms, then the diagnosis becomes difficult. So please get that. At the start, we all couldn't get tests. We didn't have access to it. There was no community
Right.
testing in the UK, so we had no option. But definitely now, the testing is available. People should get it. But I think we should really always acknowledge how many barriers there are still to testing because
Hmm.
testing means a big disruption to life. And I think if you're somebody who's struggling, if you've got really a kind of a job that you can't afford to take time off sick, if you've got kids and you have to keep them all off school, I mean, huge disruption, social and financial. So particularly for people on low incomes, which is based, just because you decided to test, just
Hmm.
even if you're while you're waiting for the result of that test. So unless we remove these barriers against testing, then there will always be these barriers. So people don't get tested, and that has implications in terms of the infection spread to the whole community, but also implications about in terms of that diagnosis if people develop long COVID later.
Yeah, absolutely. An important advocacy point. And it's doubly so because it is, still low income communities of color who are most affected by
Mm.
COVID. And so, that's really one of those multiplier effects. So that's important why we keep advocating for that. So the similar question that I was bringing up is if you have a breakthrough case of COVID after being vaccinated, can you still get long COVID?
Yeah, so this is a big question now, and so obviously there are breakthrough infections that are happening after vaccination, but vaccination should be, largely protective of getting the infection. But if you do get infected, I think there was some reports from the patient advocacy groups that there might been cases of long COVID developing, but um, you also need time, I suppose, to establish that. And I've not seen it, in a study published or to my knowledge on it or something like that. But I wouldn't. If you do develop acute COVID following the vaccination, then I wouldn't be surprised if you then, you could develop long COVID after that. But I think the primary thing is to say, vaccines are largely effective. So actually,
Hmm.
by taking them, you are definitely reducing the chance of developing long COVID. So it's important to not to lose that message. They're not 100%, but they are very largely effective. So I think for the prevention of long COVID, vaccines should be advocated really.
Absolutely. And speaking of which, we've been hearing, I've heard this a lot initially, that some people got the vaccine and it alleviated some of their long haul symptoms. Is that possible? Is that something that's been studied more since the initial rollout? What do you know about this?
Yeah, I think there are studies ongoing. For example, at Yale, I think they're doing exactly that, looking at the effect of vaccine in people with long COVID. There have been small studies where they um, looked at the effect. They asked people about their long COVID symptoms after the vaccine. I think there were more people in these small studies which said their symptoms improved than there were of people who said their symptoms worsened. There were also people who said their symptoms worsened, but there were less. Um, but I think it's really, really difficult because of what I described about the relapsing nature of long COVID. So really, it's difficult to establish causality. So if your illness fluctuates, and then you had the vaccine in between, and then it comes back and you get a relapse, or it doesn't and you get a remission and you've got a good period, and then you get asked whether that's made you better or worse. In your mind, you're tying whether the vaccine has had an effect, but actually it could have happened anyway, without the vaccine. So it's all of that consideration we put into, is it causal or is it
Mm,
something incidental or is it just an association? So unless we have longitudinal studies where we
right.
properly follow up people vaccinated and non-vaccinated on more than one time point, it's difficult to establish, and we're not there yet. I'm aware most of the questions you're asking me, I'm saying, oh, we don't know yet, we don't know yet. But
Yep.
that's the state of play, I think, with long COVID at the moment. Yeah,
Yeah, I think that's a common theme with a lot of things with COVID and over time, but particularly for
yeah,
long haul stuff where it will just take
yeah.
time. But in the meantime, that doesn't mean we ignore it. We got to keep,
No,
our eyes on what's happening and keep advocating it and making sure people get the care they need. So Matt has a great comment. Can I just say I appreciate all the thoughtful questions. It's often hit or miss in the comments with anything COVID. Yeah, we appreciate our community really. You've done amazing advocacy work. So thank you for all these important questions. As we say, all of these things, it's important to keep discussing. The pandemic is not over. There are many people who need help, they need care. And so it's important to have these discussions today. And thank you again to Dr. Alwan for joining us and, helping
no.
us with these important questions.
Can I
I
can I
think,
pick on a
yeah,
quick one in the chat? Just a quick one
please.
about whether is there polyas if there's is higher heart rate a symptom of long COVID? Um, there is something called associated with long COVID, and also seen in other post-viral illnesses called dysautonomia. So that's where there is some disturbance to the autonomic nervous system. So this is the nervous system that controls the things that we don't think about in terms of our blood pressure and how the heart beats. And there's something called postural also orthostatic tachycardia syndrome. So POTS, that's what it's called, and that's
Mhm.
been seen in people with long COVID as well. That includes, obviously in the name having tachycardia. So that could be a manifestation, and that's also something that a physician could easily try and test and see, by of the patient. So that's a possibility. Yeah, yeah.
Thank you for that. And thank you for that question, Polymath. Here's a sort of scientific question. Is long COVID caused by the immune system still being aggravated or by remnants of the virus still hiding in the body? Do we know the causes of long COVID yet?
So again, these are the two. These are the two most hypothesized mechanisms, I think, for long COVID. And that is it just that the immune system going into auto drive. And I think again that relapsing nature is similar to some other autoimmune diseases that we have in terms of the pattern of it. Um, or is it that there is some sort of a low level viral activity protein still there? Because there have been studies that found in biopsies, say in the gut, for example, that the virus is detected. That's not necessarily long COVID. That's in people who've had COVID, and after a few months, that's been detected. So I think that we still don't know. Again, we don't know and we don't know if they happening together are, as well. So it might not be an either or thing, um,
Right.
or it could be that people have different mechanisms, and maybe that then explains the differences in the symptoms of people as well. So all of these we don't know, but research is happening, and the NIH are funding research on long COVID now. The same happening in the UK. So
Hmm.
really hope that we find some, because that's the key to therapeutics, is to understand the mechanisms. Uh, but that and I suppose things could be done for things like I discussed. The dysautonomia. There might be symptomatic treatment. There is symptomatic treatment for that as well. So there could be things that could help people before the definitive understanding of the mechanisms as well.
Thank you for that. Julie asks, are researchers of long COVID building on knowledge from other post-viral syndromes, EME, chronic fatigue syndrome? Do you know what knowledge has been sort of imported from what we've known
Yeah,
in the
I mean,
past?
yes, I think they should absolutely. Uh, the ME, chronic fatigue syndrome, has been. I think the community has been really helpful for people with long COVID because this is they've helped in terms of sharing the resources, what helps, what doesn't help. So in terms of peer support, I think that's been very helpful. But in terms of research, ME/CFS has been also largely under research condition over the years. So I really, really do hope
Mm,
this is the silver lining of long COVID, where if you pour money into research of long COVID, then you would these other conditions, ME/CFS, and even other conditions such as fibromyalgia, for example. These conditions were really can be debilitating for people who've not had enough research into them. That hopefully the long COVID could inform the kind of the treatment and prognosis of these conditions as well. So yes, we definitely need to build on knowledge. I suppose what I'm trying to say is the knowledge hasn't been great because there hasn't been a lot
yeah,
of resources dedicated to understanding these conditions. We would have been in a different place now with long COVID if that was the case and we understood these conditions more, or the other post-viral illness. But this is the lesson to learn now, to
absolutely.
prepare in the next pandemic in terms of preparing for the burden, if of chronic illness, but also now if you put in the research, then we would understand what triggers the illness, and maybe we can prevent most of it if it happens in the future. So I think that's the silver lining of long COVID. But yeah, absolutely, I think we shouldn't be looking at it in isolation because there are these other similar conditions.
Absolutely. And one last question. I think this is a good one to end. Thank you, Kara, for this. I teach a young teen with long COVID, and I want to know what I need to do in order to best support him. Do you have any tips for supporting loved ones or people we know with long COVID?
Yeah, I mean, apart from obviously, they need the medical, as I said, the medical assessment, investigation, and the care plan. But in terms of us, in terms of loved ones, people we know, I think really, really important to listen to them and believe their, symptoms. I think the dismissal sometimes is not just from, you know, the medical, community or doctors. I think there's a lot of dismissal in society as well for when people don't understand, some of these symptoms or um, and what causes them exactly. That there might be something, dismissed. And sometimes, mostly, this comes really from a very good place. People very, very trying to say or do their best, and so they say something like, "Well, it's fine, get out, or do this, or forget about it,
Hmm.
or it'll be fine. Oh, look at there are people who are much worse than you. This is happening to them." But I think these things don't help very much. I think it's mostly about listening and believing what people are describing. And even if we can't offer, solutions to the problem, I think, very big part of the solution is to listen and believe, and just provide some empathy, for people. I think that I don't know that that's a simple thing, but I think it's really profound. We've learned in long COVID that it's people understand, even teens, they will understand if there's a lot of uncertainty about what's going on. How do I, get over this? If they are believed and um, and listened to, then that does make a difference.
Thank you so much. You're right. Being seen and being supported is
Yeah.
everything. So, those are really important points. Before we go today, could you please let us know how people can connect with you and support your really important work?
Yeah, absolutely. I mean, I suppose I'm on Twitter. So do I say my Twitter account?
Yeah.
Yeah. So it's
Yeah. Let
Doctor
people
Two.
know.
Yeah, Doctor Two. So Doctor number two, and then Nisreen Alawan. And yeah, or they can email. They can just Google me, and they'll find my webpage, and there's an email address there as well. So I think you can find me easily on the internet.
Fantastic. And thank you so much for joining us today, Dr. Alwan. Your voice and advocacy has been so critical and inspiring during this pandemic, and we are so grateful for everything that you've done. Thank you for joining us.
Thank you so much for inviting me. Really enjoyed this. Thanks. Thanks.
All right.
Bye.
Bye. And thank you all to you all in our wonderful community who joined us today and took part in this really important conversation. Please remember the pandemic doesn't end when we've secured our own safety by getting vaccinated. No one is safe until everyone is safe. We must keep fighting for the safety of others. Millions of people are suffering from the long-term effects of COVID. We must keep advocating for them by contacting our officials and asking them to fund research, care, and treatment for long COVID, and keep advocating for public health measures that protect the vulnerable. And if you have long COVID, please know that you are not alone. We will keep speaking up and fighting for you. Thank you everyone for watching, and we will see you next time. Bye.